There is no one-size-fits-all solution for any business. Your businesses are all different. The kind of benefits you provide to your employees are different, and how you'll work through the ACA is based upon what your businesses want to accomplish and within your own culture. Our job as experts in benefits and in the ACA is to guide you on that path and help you make the best decisions you can as you work through this complex law. Today we've got some experts to begin to talk about that, and I'm pleased to introduce the first person, one of our senior partners in our benefits practice, Kevin Norris. Kevin?
Thanks, Gary. So it was April 2010 when we first got together to talk about this stuff. And I'm glad that it's all so clear now, or at least we're so sure that we understand it. At least the people on the street would indicate that. There was a book that came out last year. I don't know if any of you are familiar with the author, Nate Silver. He's a real well-known blogger. The 538 blog is very well-known, but he's primarily a statistician, but also an author. And his book last year was a bestseller that was about statistics and probability, why we are so bad at making predictions. And his quote is that the signal is the truth, and the noise is what distracts us from the truth. And obviously there's a lot of distraction around healthcare reform today. There's a lot of misinformation. In fact, I think, Bob, you have said that if we just turn off the news, we could probably get to the truth a lot faster. But today we want to be able to try and get a little bit more at some of the truth, some of the facts as to how healthcare reform is affecting you employers. You know, we hear a lot today in the news about what's going on with the exchanges, what's happening with the individual plans. But the reality is that healthcare reform is moving forward for all of us who sponsor employer plans. And so we wanted to be able to get in front of you again today to remind you of some of those things that are relevant, that are true, and affecting you going into 2014. We're lucky to have Bob Radecki join us. Bob is our compliance expert. He's the guy that we go to with questions on this. Bob has over 25 years experience in the HR and employee benefits industry, helping people like us and you with difficult benefit and compliance issues. Bob was the principal HIPAA consultant to a number of health insurance companies and is recognized as a leading expert on a variety of benefit compliance issues, including COBRA, FMLA, CDH rules, and more. And I suppose healthcare reform has kind of dominated your life over the last few years. Bob has been the featured speaker at many industry events and conferences and has published a number of articles concerning various compliance issues. As you hear him speak, you may recognize his voice because he is the voice behind many of the webinars that we have put on over the last few years on the subject. So I want to welcome Bob Radecki, and we appreciate your being here, and we'll certainly be able to answer as many questions as possible throughout the seminar.
Thanks, Kevin. So I love it when you read my mom's introduction she wrote for me. So Kevin mentioned the webinars. So many of you, as soon as I start talking, make fun of my Minnesota accent, but you may have heard the webinars that we do monthly on compliance issues. But whenever anybody introduces me that way, I always get kind of nervous because usually the reaction I get is something like this: "Oh, I recognize your voice. You look different than I thought you would." And they always look so disappointed. You know, I think people build up the image of what someone's going to look like when they hear a voice, and we can never live up to it. Now, here it is. So before we get into the content, I just want to expand on a couple things that Kevin said. And one is, what I'm here today about is to focus principally on how these rules affect employer health plans, right? There's lots of stuff going on. There's lots of news about the Affordable Care Act right now. And by the way, I'll be using the term ACA because that's simply what the regulators use. I don't care if you call it PPACA, PPACA, Affordable Health Care, Obamacare, I could care less. I just use the term ACA because that's when you read the regulations, how they refer to it. But again, our goal here is to think about what this is doing to how you manage your employee benefit plans. There's a lot of other things out there, but we're going to try to stay focused on that. We have to comment on some of these other things just to recognize the obvious, but we're not going to spend a lot of time, for example, talking about the technology issues that we're hearing about and things like that. Before we start, though, I thought I would share one other piece of information with you. You know, we had this experience recently, the shutdown that we all struggled through, and Congress right now is not the most popular group of people in the entire country, as we know. But I thought to make you all feel better, I wanted to share with you some images of other legislatures around the world, just to show you that we're not exactly alone. Okay, in Italy, they're passionate, of course, right? But in China, everything works perfectly, right? China, everything works absolutely smoothly and perfectly. So so I just thought, help us feel a little better here in the United States. We're not the only one. The real reason I put that up there is to recognize the fact that there is a lot of debate about this, appropriately so. But my job is not have to do anything to do with the politics. I'm not a lobbyist. I'm a boring analyst. So I read this stuff and try to interpret it and figure out how to deal with employers. If you want to have the debate about this law at happy hour tonight, that's a beautiful thing. It's just not where I'm coming from. I'm Switzerland when it comes to the law. Okay? All right. I'm going to start just for about 2 minutes. As Kevin mentioned, we've been talking about this since 2010. I don't know, I've lost count of how many employer groups I've spoken to about this law. And I think one of the things, and I love this, I love the setup, Kevin, is there's so much noise out there that we've lost track a little bit of what's really going on sometimes, right? And not to beat up on the media too bad, but the media is really good at covering burning buildings and yelling people. It's not so great at covering very detailed, difficult, complicated issues, right? And so I want to bring us back just for a minute about what the core of this law was really about, whether you agree or not. It's not a debate about whether you agree or not, but what we've forgotten about, a lot of the rules that we talk about when we talk about employers, we forgot that they're there for a very particular reason, and that is the core of this law was about reducing the number of uninsured. Let's be honest. That was the main real purpose of the law. And all these different rules that we tend to talk about, when you think about that, feed that same purpose. Why do we have an individual mandate that you're going to get taxed if you don't have health insurance, to have more people buy health insurance? Why do we have these subsidies that are going to help pay for your insurance if your income is low enough, so we can help people have health insurance? Why do we have rules that say employers have to offer insurance to their employees so more people have health insurance? See what I'm saying? They're all legs on the same stool to try to address the number of people that have insurance in a bunch of different ways, right? So when you think about all these rules we talk about, remember that goal that these different rules have. So why is that even a problem? Why do we even talk about health insurance? A lot of people don't realize this, but if you just tell me 2 things about somebody, I can tell you how likely it is whether they have insurance or not. Where they live, because the uninsured rates in this country vary dramatically from state to state, depending on state programs, state insurance markets. A lot of you don't realize this, but large employers that do their own insurance thing often don't realize that the individual and small group market is radically different from state to state. Okay? And that has affected the uninsured rates by state. But the other big factor is how much money do you make. Okay? This is not rocket science, people. If you make a lot of money and you got a great job, you probably work someplace that does what? Offers you health insurance. If you have a job that's very low wages, you're more likely to work someplace that does what? Doesn't offer you health insurance, and if you're a low-wage worker, you can't afford to buy it yourself. This is a blinding glimpse of the obvious. Okay? The reason I show it to you is when I talk about the subsidies that we're going to talk about in just a minute, remember this slide. Because when I show you how the subsidies work that you're starting to hear about, you'll see the direct connection to this issue of uninsured based on income. Okay? So just remember the slide when we get to that part. Last thing I want to comment on just before we get into the actual rules is we get asked a lot, what's going to happen to the insurance world, after this law. This study was done back a couple of years ago, and I still think it's really valid. I still subscribe to this is very valid. This is really easy to read. You don't need to look at the little numbers. What this was a study of predicting where people would get their health insurance had this law not been passed versus where people will get their health insurance due to the changes, due to the Affordable Care Act, right? And so the red bar is where would people be getting their health insurance in 2019 if the law were never passed. The blue bar is where would they be getting the insurance in 2019 now that we're living through this new law. So you look at the first one, I think is really interesting. It predicted that in 2019 about 165 million of us would be getting our insurance through our employers if we hadn't had this law. After the law is fully implemented in 2019, we think about 165 million people are going to be getting their insurance from their employers. Okay? I think that's right. I don't see a seismic shift in employers offering health insurance to their employees. Now, what's interesting about this, there's some changes here. That's not the same 165 million people. We see some employers maybe backing out of offering insurance. We see some employers coming into the market. So there's some movement here, but I don't think it's a game changer from the employer-sponsored health insurance perspective. Okay, we'll come back in our seminar in 2019 and see how close we were. Right. The other two on there that I just want to point out are, of course, if there was no law, there wouldn't be anybody buying insurance through the exchanges. Now this is predicting that someday, if they can ever get through some of these issues they're dealing with, that there'll be millions of people have bought individual health insurance coverage through the exchange. And then the last number to point out on there is, notice the uninsured number, the last column. Okay, we think that there's around 50 or 60 uninsured people in the country. 50 or 60 million uninsured people in the country. Yeah, we think there's 50 or 60 uninsured people in the country. Yeah, that's right on. And after this law is fully implemented, we think there's going to be 20 or 30 million, give or take, 5 or 10 million here or there. The law never, ever was designed to eliminate uninsured. It's trying to reduce it. Okay, so that's the backdrop for what about you? Now, what Kevin, I think, I don't know if you said it or if I just dreamed you're going to say, we've got a really diverse group here. We've got some small employers in the room and some very large employers in the room. So as we go through the next few slides, unfortunately, some of it's not going to apply to all of you, right? If we're going to talk about small group insurance rules, then all the large employers in the room can go get a cup of coffee, and vice versa when we're talking about the employer penalty. So we'll try to do a good job of distinguishing what rules apply to what people. And then the other thing Kevin did say, I do want to encourage you, I'll take some questions during the session. We've got this part, is going to last about an hour, and then we've got some other things to cover. If we have too many questions, I'll cut it off and move along. But if you're thinking a question, somebody else is probably thinking the same thing in the room. So raise your hand, yell it out. We should be able to hear you. And I'll break between the sections and see if we can handle a few questions. So let's talk about these health insurance exchanges you've been hearing about. First of all, I'm going to use the old word. Sorry, it's hard to teach an old dog a new trick like me. They're not exchanges anymore, right? You've heard it's the federal marketplace or the state marketplace. They've been rebranded, but it's the same thing. I still use the term exchange, but if you want to use the term marketplace, that's fine. First thing that there's so much confusion about when we talk about these exchanges in the marketplaces, the first question you have to ask is, what state are you talking about? Okay, because what's going on in Minnesota is incredibly different than what's going on in Alaska, or what's going on in California, what's going on in Washington. Because the map is a little out of order here. I've got a map here that shows, there's about 30 states that have defaulted to let the federal government run the exchange in those states, and that's the exchange that's in all the news these days, right? If you listen to the national news, it's talking about the federal exchange, which actually doesn't apply to you here in Washington State. Because you got your own deal. You set up your own exchange with your own technology and your own administration and management. The issues are different here than they are in the 30 states with the federal exchange. So you can't listen to the news about exchanges and make an overall statement about it. You have to say, what state are you talking about? And what's going on there? Okay? At the end of the day, what I've said about the exchanges, and hopefully there's nobody here from the Washington State Exchange, they're not going to like my next comment, I don't think, is for a big part of it, it's not all that interesting to me. It's a place where insurance companies sell stuff. That's what it is. It's a place where insurance companies sell their individual and small group products. Okay? If you're a large employer, you'll never be purchasing anything through the exchange. Okay? Now, the far more interesting role of the exchange to me is the administration of these subsidies we're going to be talking about. Certain individuals, right? This is what's been in the news. Certain individuals, when they go buy individual health insurance, might get a tax credit to help pay for it. And the exchange is the entity that manages that process. Are you qualified for the subsidy? Where do we get the money for the subsidy? Report the IRS, report the income. The exchange is here's what I like to tell large employers. Large employers that have online enrollment systems for their employees, right? The exchange is the online enrollment system for the individual health insurance market. That's its really most important role. And in a lot of states, there is not a whole lot of small group stuff going on the exchange. You also have to think about, right, small group versus individual. Washington is a case in point. I'm going to bring Kevin back up here in just a minute to speak more about what's going on in the local market. I have the national perspective, but I don't get as deep into each local market. But in a lot of areas, there's not a whole lot of small group stuff going on in the exchange. Okay, so you have to think about whether it's individual or small group that we're talking about. Here's what's more interesting for the small group employers. And I'll make a quick comment, and then again, we're going to turn it back over to Kevin for just a couple of minutes. Far more interesting in exchange to me for you small employers in the room were the changes that this law put in place in the underwriting and rating rules for small group insurance. And the underwriting and rating rules for small group insurance changed whether you buy it inside or outside the exchange. So that's changed all of you small employers, what your renewals are going to look like. And so having said that, what I want to do is I'm just going to step aside for a minute and let Kevin talk about some of the impact those small group changes have had on all small group plans in Washington, regardless of whether you decide to buy one in or outside of an exchange. Kevin?
Yeah, just a couple of quick comments on the Washington Exchange. As you may be aware, the Washington Exchange actually has worked pretty well, the Washington Health Plan Finder. There was a little glitch at the beginning where people that went to enroll entered in their adjusted gross income on a monthly basis, because that's what the website asked for. And then the federal exchange that determines if there's a subsidy used that as an annual income level. So that was a little bit of a problem because people actually were getting subsidies greater than the cost of the insurance. So that had to be fixed. Otherwise, most of the enrollment in the Washington Exchange has been for Medicaid. About almost 90% of the enrollment's been for Medicaid. So people who've had individual plans with the carriers that aren't getting subsidies are tending to still buy their insurance the same way. That really hasn't changed. One of the things, though, that's been a little bit of an eye-opener for people that will have implications, I think, down the road for small group plans and perhaps even for large group plans, but it will be optional, will be that people are realizing the plans that they are being offered are different. So these metallic plan designs are different than what they were expecting, perhaps, or what they had. But the other thing that's been shocking to people is the networks are also different. There is a lawsuit right now that's been filed by Children's Hospital against a number of these carriers because they have been excluded from the networks. And it's something that we expect to see flow through to small group plans in the future as well, that we are expecting to see narrowing of networks as a means to lower the price. If it costs X to get a colonoscopy at Overlake Hospital and X plus 50% to have that done at Swedish Hospital, should we be reimbursing on the same basis? That's something that I know is being looked at by the carriers. Bob mentioned the shop exchange, the small employer exchange. We have that operational in one county in Washington State, so that's only in Southwest Washington. The problem that I see with that, I was going to ask you, Bob, is that's the only way small employers can get their tax credit.
Yes.
So I don't know if they've answered that yet as to how small employers would otherwise get it in 2014. Bob mentioned the small group underwriting rules. This is really interesting for us, and it's also very challenging. Now, in Washington State, we have already had community rating rules for groups under 50 employees. So the effect of these small group underwriting changes have not been as impactful. But the most impactful thing is that the rates now for groups under 50 are all age-based per individual member. So when we get a quote now for a small group under 50, not over 50, under 50, we get a separate rate for each individual member covered under your plan. Now the question is, what do you do with that? Are you going to be charging employees contributions based upon each individual person's employee, spouse, child, their individual rate? Or are we going to create blended rates so you'll charge based upon that? A lot needs to be determined still on that, and I think a lot will be dependent upon how much turnover a company has. It's a lot easier if you don't have any turnover to create a blended rate. If you have a lot of turnover, that gets pretty screwy. The other thing that's changing for a lot of people that have small group coverage are the new bona fide association rules. Nearly 500,000 people in Washington State have coverage through association plans. This is where all the acronyms come in: WAHIT, CHIT, the Evergreen Security Trust, the WTIA plan. A lot of employers offer their group coverage through these associations. These associations have not been true bona fide associations, meaning that they have not been homogenous based upon industry. They now have to be homogenous based upon industry. It's easy for a WTIA, a trust based upon technology companies, to be that, but a chamber plan or plans like the WAHIT plan, those are going to be going away in 2014 or being significantly modified to comply with the homogeneous bona fide association rules. So if you have your coverage through a WAHIT, or Evergreen Security Trust, or one of these other non-bona fide associations, we will be talking in 2014 about what your options are, whether through another bona fide association or outside one of those trusts. Okay.
Thanks, Kevin. So we're going to shift gears to large employer rules in just a second here. Any questions for the small employers in the room? Rating, underwriting, the things you're worried about for small group plans? Do we tell you about the $100 we give for first person to ask a question? Oh, no. Okay. All right. Yep, sir. Yeah. That was worth 10 cents. So, again, what we've been talking about here is the rules around small employer plans. Let's shift gears to large employers for a minute and talk about the shared responsibility rules, payer play rules, employer mandate. Again, there's so many names for this stuff, right? Just to pull us all together, what we're talking about is we all know that this law says if you're a applicable large employer is the term, that you have to provide benefits to all your full-time employees or you're going to possibly pay a penalty, right? And we've been talking to you about this for the last couple of years. And so unless you were on vacation in the Bahamas in July, you probably didn't miss some pretty big news. I was driving from Minneapolis to Denver, Colorado on July 3rd for a long weekend when my cell phone started ringing off the hook. I think Kevin was one of the first calls. Bob, they delayed it. What the heck are you talking about? They delayed the mandate. Well, no, they didn't. Yes, they did. So IRS decided that the employer mandate was going to be pushed out until 2015, right? So we had been spending a lot of time in June getting employers ready for January 1st, 2014, when you all thought you were going to be complying with this, and then our phone stopped ringing in July because you all decided to just take a deep breath and pause. That's okay. That's okay. But I'm going to make a plea to you now, and I'm going to repeat it in a minute here. Don't wait till next July or August. If you're not prepared for these rules, how they're going to impact your company, get it ready now, and let us help you do that sooner than later, because it's going to be another circus next July and August as the employers that did wait try to get themselves ready. So what was delayed is now employers don't have to worry about this rule to cover all full-time employees. Large employers can essentially continue your current eligibility rules for 2014 that you have now, and you'll pay no penalty. To be really technical about this, in case there's any lawyers in the room that care, the law wasn't delayed, the rule wasn't delayed, the IRS delayed enforcement of the rule. So then that's happened before for other things. The IRS has basically said, we're not ready to enforce this rule yet. And so we're not going to enforce it for 2014. We're going to not start enforcing it 2015, which essentially means you don't have to do it. The second thing that was delayed was the employer reporting requirements, very significant employer reporting requirements that a lot of you didn't even know were coming yet, were delayed. There was new employer reporting requirements scheduled to go into effect in January of 2015 for information about 2014. I'm going to talk about these in detail here in just a second, because this is important. You've got to get ready for these. That has been delayed now. The new employer reporting requirements will not go into effect till January 2016 for 2015 data. So we've been given an extra year to get ready for these employer requirements. I'm going to give you kind of the first look at these reporting rules, because they're significant enough that some employers are going to have to do some very significant work on your processes and your systems to get ready for them, but at least we have a couple of years. So I'm just going to give you a taste of what they are now, and we'll be working with you a lot over the next couple of years to prepare you for these rules. Before I go into the rules, if you think about it this way, I think it'll help give you a perspective of what you'll be doing. Think about it as an entirely new W-2 kind of process. It's really what it's going to be. This is going to be for large employers. They're going to have to provide specific information to the IRS about your benefits and what benefits your employees have. And you're going to have to give your employees a statement. That's what the IRS calls the W-2, is an employee statement. So I'm not saying it's part of the W-2. Let's be really careful here. I'm not saying it's part of the W-2. It's going to be an entirely separate process. It's going to look and feel a lot like what you do with W-2s now. Same timing and everything. Statement has to go by January 31st to employees. Get it? So almost think of it, I'm going to, for the fun of it, just now call it the WH, healthcare. That's not what it is, but to help put it in perspective, right? So two things about these rules. These rules only apply to applicable large employers. So if you're a small employer, you're not subject to the new reporting rules. But if you're an applicable large employer, there's really two things you have to be aware of. First, I call them the coverage report and the employer plan report. That's just to help distinguish between the two. You'll hear them referred to as the 55 reporting and the 56 reporting. That's just a section of the code. The coverage reporting means that someone is going to have to tell the IRS what coverage Bob has. If you're fully insured, your carrier is responsible for this reporting. So your carrier will be sending to the IRS, if you're fully insured, saying, Bob was covered by such and such a plan, January, February, March, April, May, June, and July, or whatever. Okay? And then they're going to be giving me a statement. Why is the IRS interested in knowing whether I'm covered or not? Because there's a tax if I'm not. This is part of the law. You've heard a lot, again, we talk about the noise, right? We heard a lot of noise about, how people are going to know this, that. Trust me, the IRS is good at knowing what they want to know, okay? And because there's a tax involved here, there's part of the law is either the insurance company is a fully insured plan, or listen to this, for self-funded plans, the plan sponsor, which is generally you, the employer, are going to have to send the IRS information on what coverage people had during the year. And then give them a statement that they'll be able to use when they file their taxes to show whether or not they owe that individual mandate tax. Okay? I would say, so people talk about, are people going to cheat and not pay that tax? Well, we are talking about taxes, so cheating and taxes probably shouldn't be used in the same word, but you know what I mean. If you report on your 1040 next year that you work for a company and they only paid you $10,000, how does the IRS know that's not true? Because they get the W-2 information from your employer. It's going to be the same thing with this. If you report and say I was covered, and they have nothing showing you had coverage from anybody, you may get a phone call. Okay, so that's the reason for this first reporting. So I said, for fully insured plans, the carrier will do it. For self-funded plans, employers are responsible. The second report is called the employer plan report. And this, employers have to do whether you're fully insured or self-funded. This is an employer responsibility. So like the first report, it's telling the IRS what kind of coverage I offer my employees. Why do employers have to tell the IRS what coverage they offer their employees? Because of the employer mandate rules. Okay, so they're going to know what employers offer their employees. They're going to know what coverage people have to be able to administer these tax laws. Okay? This is actually the reason, I love it, and Kevin, we laughed about this. When they delayed the individual mandate, what they actually came out and said is, they're delaying the reporting requirement because we're not ready to implement this reporting requirement yet. Oh, and by the way, we're also going to delay the mandate because we got to have the reporting, okay? Where we all went, that's a little backwards. We want to, the mandate was what we were more concerned about. But, so, again, I'm not going to go through in detail. But if you're a large employer, you need to start working with your HRS system, your payroll event. And all this stuff isn't in your payroll system. If you look at some of the list of things that are in some of these reports, what coverage did Bob have? What months of the year was that covered by the plan? That's not in your payroll report, right? That lives someplace else, okay? So this is what you need to start preparing yourself with your large employer to be able to handle this reporting. Again, when? January 2016 will be the first time you're required to do this for 2015 information. Okay. This is my second plea. When our phones stopped ringing in July when they delayed the mandate, I got terrified because I know what my summer is going to be like next year, right? And so do all of our staff, right? This isn't going away. We now know that. Will it change again? Yeah. There'll be changes to it. But as an employer, we really need to help you prepare for 2015 now. And let's do that right after we get done with our renewal. Get done with your January 1st renewal. Get the open enrollments out of the way. But then take it seriously early in the year because it's going to be a little crazy later in the year. A real quick comment about the penalties. So I keep mentioning these employer penalties. We've had entire seminars on these, so I'm not going to go into them in great detail, but I want to give just some perspective. The benefit staff at Parker Smith and Feek has been working really hard at looking at every one of our clients and seeing how these penalties may or may not affect each particular employer. And the comment was made that every employer is different, right? And it's so true. How this affects every employer is incredibly different, but we've learned a lot, okay? And one of the things we've learned is for most of you, and Kevin, I'm willing to let you argue with me on this one if you want to, but I think you agree. For most employers that we work with, we're able to adjust their benefit offerings in a way to eliminate the risk of these penalties, okay? It's a relatively small subset of employers in certain industries, hospitality, restaurant, things like that, where it's a lot more challenging. But has that been your experience?
Oh, no, absolutely. So the analysis that we've done on clients, even those that have, let's say in the hospitality industry, that have lower paid workers, we've had very few situations where we're showing that the employer would be penalized because of the affordability definition.
And if you have changes to make, I mean, we're able to, so things we run into are things like this. Oh, I have an employer client that only offers a very expensive high option plan, right? Well, it's not affordable to a bunch of employees, so what we can do, we can put a lower option plan alongside it, things like that. So again, the vast majority, we think we've been able to set you up so there's little or no risk of these penalties. The tougher job is this whole full-time employee definition that I'll comment on in just a minute. That's a little more interesting for some of you. I'll comment on in a minute. And just so you're aware, there is also some confusion about the word affordability. Okay, I want to clear this up. When I'm going to talk in just a minute about people qualifying for health insurance subsidies by buying individual insurance, I'm going to say if the coverage their employer provides them is unaffordable, they might qualify for these subsidies. Okay? And that unaffordability determination is based on that employee's household income, which you don't know and you never will know. Unless you collect your employees' tax returns, you will not know their household income, right? The only company I know that knew their employees' household income was The Firm. Remember that movie? They knew everything about their employees. So you're not going to know their household income. So, but that's what the affordability of somebody getting subsidies based on. So what the IRS did was, well, you poor employers, you're never going to have household income, so we're going to give you a safe harbor. We're going to let you set your contributions based on what are called affordability safe harbors, so you won't owe a penalty if you base your contributions on wages or rate of pay, things that you do know, okay? But they're two different things. You might set your wages based on the wage affordability rule, and you won't pay a penalty where you might have an employee actually go qualify for subsidized coverage. Let me give you a simple example, okay? I make $50,000 a year working for Parker Smith and Feek, and their insurance is $150 a month. That's less than 9.5% of my wages, so that's obviously affordable. I could never get a subsidy, right? Wrong. They won't pay a penalty because they've set their contributions at an affordable level, but my household income is based on my adjusted gross income. Any accountant in the room is going to hate the way I describe this, but your adjusted gross income is the bottom line of the first page of your 1040. Right? So you have to take your income and any business losses and things like that to get to your adjusted gross income, okay? So one of the things that goes on adjusted gross income is alimony payments. Well, I make $50,000 a year with Parker Smith and Feek, but I pay $40,000 a year in alimony payments to my 3 former wives. Stuff happens. So now that $150 a month I pay for insurance at Parker Smith and Feek is unaffordable to me based on my household income. And I would qualify for subsidized coverage on the exchange. But Parker Smith and Feek would not pay a penalty because they've set their contributions based on the employer affordability safe harbor. So we get lots of questions confused about those two. If we help you set your contributions carefully, you won't pay a penalty, but you still might have a handful of people that will qualify for subsidized coverage on the exchange. Big deal. Okay. All right. Here's the bottom line with, I think, the penalties on the affordability side. So I've already mentioned it. You know, setting the safe harbor, you have to make sure your contributions are less than 9.5% of an employee's pay, basically, right? Very, very few employers are ever going to pay a penalty under the affordability penalty rules. Do the math. Take somebody with a $24,000 income, not exactly a high-wage worker, people, okay? 9.5% means you would have to be charging more than $190 a month for that person to participate in single coverage for it to be unaffordable. I didn't mention that before. It's a pretty important thing I left out. The affordability is based on the cost for the employee to participate in single coverage. That's not the premium. That's what they have to pay. That's their contribution, okay? So how many of you charge more than $200 for your employees to participate in single coverage in your low option plan because you only have to offer one affordable plan? You might have 4 plans you offer. One's affordable. The other 3 are really not affordable. I don't qualify for the subsidy. You don't pay a penalty as long as I'm offered one affordable health plan. Okay? So when you look at that number, you can see I think I can pretty safely say very few employees. You've got to have a lot of very low-income workers with a real high contribution requirement for single coverage before we're going to have an unaffordability issue. Fair enough? Any questions? I've stunned them into silence already, Kevin. All right, so we've talked a lot about this delay. We got a year to get ready for the reporting. We've got a year to get ready for the new employer mandate. But that didn't change a lot of other things. So I'm not going to go through this slide in gory detail one by one. I think Kevin's comment was if we wanted to cover every one of these issues on this next slide in detail, we would take about 3 hours. But more importantly, these are the things that we're working with you right now to make sure that your 2014 plans are set up properly, right? Because there are some things that are going on right now that are important. You have to make sure that your plan designs are set so the maximum out-of-pocket rules are met. We have new rules. Our plans can't have a maximum out-of-pocket any more than a specified level, right? If you're fully insured, this is really easy. You won't be able to buy one. Okay, a carrier won't sell you a plan that has maximum out-of-pockets that violate this rule. If you're self-funded, we're going to need to work with you to make sure your plan designs are set properly. One of the things that I've heard, and I don't know how common, maybe I'll ask you to comment on this guy, I don't know how common this is. In some markets, old rules like the physician copay for office visits often didn't roll up into the out-of-pocket, that was separate from your max out-of-pocket. Under these rules, I use a poker analogy, it's all in. Once an employee has paid $6,350 in any cost sharing, copays, deductibles, coinsurance, anything, the plan pays 100%. Okay, so that's going to take some adjusting. Do we have some plans that work like that?
Oh yeah, well yeah, sure. Because our plans up until now have typically had separate deductible and coinsurance accumulations, and now it all has to be, like you say, rolled up into one. The carriers are figuring all that out. The question that remains is whether or not prescription drug copays will roll towards that. There is a deferral for 1 year on plans that have a separate prescription drug plan.
Yep. So for 1 year, if you got separate prescription drug plans, you can have them be separate out of pockets. But by 2015, they'll need to be talking to each other and combine. Good point. So that's one we're working on with you right now, making sure your plans are designed properly. For that plan, by the way, that rule does not apply to grandfather plans. There's still a handful of people we work with that have made grandfather status, fewer and fewer, but there's still some. And this out-of-pocket rule does not apply to grandfather plans, so they could have higher out-of-pockets theoretically. The second one is the waiting period rule. You've all heard about this, right? We have to compress our waiting periods. We have to have waiting periods of no more than 90 days after someone reaches eligibility. And what I mean by that, reaching eligibility, is I might be part-time with you for years, and I go full-time, and now I'm eligible for benefits for the first time. Well, then I could have a 90-day waiting period because now I've become eligible for benefits, right? Or a new hire that's hired as a full-time employee. You can no longer have a waiting period of more than 90 days. There is a special rule for multiple employer plans that have hours of service requirements. Some plans you have to have 1,000 hours of service before you're eligible for benefits. That's okay as long as it doesn't exceed 1,200 hours. But some of you have had to adjust your waiting period rules, right? The third one I want to comment is I desperately look for good news in my job because I go around making people's lives miserable for a living. It's no fun at all. And so I always want to look for good news. And here's that piece I don't want you to miss. The new COBRA language the Department of Labor released. Department of Labor released some new COBRA language that essentially encourages people having a COBRA event to go look at what's available for individual health insurance through the exchange. Now think about this for a minute. Individual health insurance is now available with no medical underwriting, no pre-existing conditions, and maybe a subsidy to help you pay for it, right? When I have a COBRA continuee looking at wanting to stay on my plan or buy that other coverage, what's the main reason most people took COBRA? They were sick. They couldn't get anything else. Okay? The average claims experience on our COBRA continuees is dramatically higher than the average employee claims experience. I want them on the exchange. Our company is going to have a 1-hour exchange training session as part of every exit interview. Okay. I'm exaggerating slightly, but you get my point, right? Now, I'm still going to offer them COBRA. I still have to make the COBRA offer, but we think the number of people electing COBRA is going to drop dramatically because there's going to be such a better deal for them buying subsidized individual coverage on the exchange. So help them understand that deal is out there so they're not on your plan. That's as from the employer perspective, that's the good news. Okay? And then the last one, I'm going to throw it out here. I'm going to give you my 2-second opinion on this and then let the vendors that are still trying to figure this out debate with me about this. There was an entire movement, some vendors out there that were pitching this model. Get out of the employer health insurance business. Just give your employees money and let them go buy individual health insurance. It's often pitched as a defined contribution model, but the crux of it was telling you as employers you can just give people money and they can go buy individual health insurance. The regulators have been attempting to squash this like a bug the entire year. We've had 2 or 3 different issues of guidance, the last one in September, that essentially says it is illegal to use a health reimbursement account and give tax-free money to your employees to let them go buy individual health insurance, okay? There are still some vendors that are attempting to argue they've got a way to weave their way in and out of the rules and the law and offer this model. I am personally not comfortable with that. If you're looking at that approach, I suggest you get good legal counsel because you are jumping into a pool that I'm not sure there's water in. Okay, so you might want to sit back on that model for a little while until the regulations and the law clears a bit, but I don't think that's going to be possible in the future. One of the, I just mentioned grandfather plans. We very rarely get to talk about grandfather plans anymore because there's not that many around. I mentioned it in this slide for one really silly reason, just to give me a really lame opportunity to put a picture of my 1-year-old granddaughter on the screen. So she even has my hair. Isn't that great? So I think we should do next July, because all these employers are going to wait to July to pay attention to this. Next July, I think we should schedule a how do you define full-time employees seminar. And it's going to cost you double because you waited that long. But, yeah. But I'm just going to comment on this whole full-time employee thing. So the law generally says full-time employees are employees that work 30 hours or more, right? That's the basic rule, okay? The law also allows you to think of it on a monthly basis. You don't have to think weekly. The law says you can think of it as 130 hours a month. So you can define full-time eligibility as 130 hours service a month. That's easier than thinking about it weekly, okay? For a lot of companies, that's fine. You're going to define eligibility month by month, and that's how you've always done it, and that's how you're going to continue to do it. Okay? But for companies that have variable hour employees, and employees whose hours go up and down a lot, or seasonal employees, it turns into a bit of a circus trying to figure out if somebody's full-time any given month and whether you have to offer them coverage, right? So we know that's the problem. So the IRS they didn't invent it because employers have been using a structure like this for many years, but the IRS adopted an optional structure for you to let you define full-time status based on this measurement period approach. Now, I'm not going to go through, because of time restraint, I'm not going to go through these rules in detail, but I want to set the perspective which ones of you should care and which ones of you should call us so we can help you figure this out next August. So if you've got a lot of variable hour seasonal employees, the measurement period approach, let's take a real simple one-shot look at it, allows you to have a measurement period of up to 12 months. Pick 3 to 12 months, but most employers are going to use 12. And measure how many hours of service that employee had over that 12 months. And at 30 hours a week, that means anybody that had 1,560 hours of service, you know how I got 1,560, is 30 hours times 52 weeks. Okay? You don't have to worry about weeks anymore. Anybody that had 1,560 hours of service during that measurement period, earns full-time status. And then you have to provide coverage for a corresponding coverage period called the stability period. So you're looking at things on an annual basis. Did I earn full-time status? If I did, I'm treated as full-time for the next year. And if you have a lot of these variable hour employees, on a year-by-year basis, as complicated as this seems, it actually turns out to be a lot easier, right? Because if you've got a lot of these variable hour employees, you're just taking this once-a-year look at who earned it this year and gets coverage next year, okay? So for our restaurants and our hotels and our ski resorts and our, a lot of industries, this methodology is a lifesaver. I'll just share one quick little story with you. I was doing a project actually for a Parker Smith and Feek client. It was a ski resort. I won't name which one. No, that's not fair. It's probably a HIPAA violation. No, it's not. But they were really worried because the ski resort had 100 full-time employees year-round, whatever the number was. I don't remember the numbers, right? And they provided coverage to their 100 full-time year-round employees. But they had another 400 employees that worked a lot for 4 or 5 months. And they were looking at what the cost was going to be to cover these full-time employees for that 4 or 5 months before we explained this rule to them, right? Using the measurement period, those employees working 4 or 5 months will never earn full-time status. They'll never put 1,560 hours of service in a given year, okay? So we essentially saved them from having to worry about providing coverage to these hundreds of seasonal employees. At the end of the conversation, I'll never forget this, the HR director from this client, it was a phone conference, blurts out, "I'm so happy I could kiss you." I said, "Well, that's a first in the compliance business. I've never had that reaction before." That was it. But it saved them literally millions of dollars from they had to cover those people for 3, 4, or 5 months at a time. So again, if you're in that category of having lots of variable hour seasonal employees, talk to us. Let us help you think if the measurement period approach is right for you. Okay. All right. So the last kind of section I want to talk about is, I know you're getting lots of questions from your employees. You're hearing about this in the news, this subsidy stuff, right? How does this work? Now, I'm not suggesting that you all should be the individual insurance counselors for all your employees, but let's be honest, it's in the news, they're asking questions. You need to be smarter than the average bear about this stuff, so at least that you know what you do and don't want to get involved in, right? So I'm going to give you about 10 minutes of how the subsidy process works, and then we're going to turn it over to Brandon for some conversation about other types of exchanges. But let's talk about the subsidy process. Before I get to the subsidy process, actually, yeah, this is your employees now, right? Dazed and confused. Hey, by the way, little piece of advice for all of you. Do not tell any of your friends or relatives that you work in the employee benefits industry this year. Do not do it, because you know what's going to happen at Christmas? It is going to be hell. All you're going to get to do is talk about the stupid law the entire Christmas dinner. That's what I do every holiday now. I hate it. So just lie. Say you're in technology. They'll believe you. We're in Seattle. So when I describe how this law works, I often describe it as the carrot and the stick. The stick is the individual mandate that we've been hearing so much about, right? If you don't have insurance, we're going to tax you. The carrot is now the subsidies. If you don't have insurance, we might help pay for it. Okay? Talk about the stick just for a minute. A couple comments about the individual mandate tax. You've heard this before, that it's relatively small the first year and gets larger each year. The stick gets bigger, right? The first year it's $95 or 1% of income. A lot of people don't realize that. It's not just $95. All the news reports say, the tax was only $95. Well, that's not true. It's the greater of $95 or 1% of your income. Now, there's a max on it. The max is listen to this, the max tax you will pay if you're uninsured is the average cost for a bronze insurance plan on exchanges nationally. So when we do our taxes next year, you remember me when you do your taxes next year. There's going to be a line, did you have insurance? I don't know what it's going to say, but it's going to say something like that. And you're going to say yes, and it's going to say, through who? My employer, whatever, okay? And if you didn't, it's going to take you, fill out form 2722BCX or whatever, right? And you're going to have to fill out, I didn't have insurance, and calculate what your tax is going to be. Okay? And it'll be 1% of your income or $95, whichever is greater, up to the average cost, which will be on the form. The max tax for next year will be $6,422 or whatever they calculate as the average cost of bronze plans. Okay? And then it gets bigger every year and becomes much more of an incentive later by 2016 There are some exceptions to who pays the tax. There is, of course, my favorite one. You don't pay the tax if you're in jail. So if you don't want to pay the individual mandate tax, just go steal something, you're fine. The other one that a lot of people don't realize, though, is the tax is not paid. Lower income individuals may not pay the tax because if the only insurance that's available to you costs more than 8% of your income, you don't owe the tax. So a lot of uninsured, lower income individuals will not owe the tax because the insurance available exceeds that amount. Okay? So let's talk about the carrot. So Alaska's up there because I was in Alaska yesterday talking to our clients up there, so I have both numbers, but you can pay attention to the lower 48. How the subsidies work is fairly straightforward. You may qualify for subsidy if you have an income between 100 and 400% of federal poverty level. Federal poverty level is a function of household size, right? So federal poverty level for a family of 5 is a lot higher than for a single person. So you've all seen the news reports. Hey, people get tax subsidies if they make $90,000 a year. Well, technically that's correct, but that's missing a point. The tax subsidies are not flat for everybody. They're based on a formula that flows from your income. So somebody at 399% of federal poverty level may technically qualify for the tax subsidy, but it may not be worth squat. Whereas somebody at 125% of federal poverty level may get a huge subsidy. And I'll show you an example of exactly that in just a minute. Okay, and remember what I said, remember the slide that when I first started about uninsured rates? The way the tax subsidies work is built to directly address that. There's more uninsured lower income with a much bigger subsidy. There's much less help for people at the higher middle income end of this range, okay? But if there's only one slide you remember, if you've ignored everything else I've said this morning, and you only remember one slide, this is the one thing. What did Billy Crystal said that in one of his movies, right? There's just one thing that you have to remember. Nobody gets the subsidies if they're eligible for affordable employer-sponsored insurance. Period. I don't care if they're minimum wage. If they're eligible for employer-sponsored insurance that's affordable, they do not qualify for the subsidies. But it gets more interesting, doesn't it, people? A lot of you know about this. To determine whether a family member might qualify for the subsidies, it's based on the cost of the single coverage for the employee. This does not make logical sense. It just is what it is, but you need to understand this because this will confuse your employees, I promise. Let me just give you an example. I work for you. You charge $25 a month to participate in your single coverage in your plan. Is $25 a month affordable for most people? I'm helping you. Right? That's tough for $25 a month to be 9.5% of anybody's income. But you charge $1,000 for me to enroll my wife and 3 children. And I make $25,000 a year. Well, that $1,000 is pretty darn unaffordable to me, right? So obviously my wife and children can go to the individual exchange, buy individual health insurance, and get that tax credit, right? Nope. They are disqualified from the tax credit because Bob's coverage for single coverage where he works is affordable. That's just how the law is worded, okay? Now, we can debate. I could waste a lot of your time telling you how we got here. I think it was a drafting error in the law, to be honest with you. Maybe I'll just blow out that, and the IRS is stuck. The IRS can interpret laws they're not supposed to write laws, okay? And I think the law is just written too clearly that this is the way it's based. I don't think it's what Congress intended. But it is what it is unless Congress changes it. Congress can't pass a law to mow the lawn right now. I mean, they're not going to change this law, right? So we're stuck with this is the definition of affordability for the foreseeable future for family members, listen to me, who are eligible for the employer-sponsored plan. If I work for a company that's a spousal carve-out that doesn't offer coverage to spouses, well then of course my spouse could maybe get subsidized coverage if income is right because she's not eligible for my coverage, okay? Second thing, real important, we're actually writing an alert on this because we've got a lot of questions on this. Our kids that we covered at age 26, you know the couch potato law? Actually, this is a law that's near and dear to my heart because my wife and I have empty nested and unempty nested 4 times. They just keep coming back. Okay? So anyway, my point is, the bit about being disqualified for subsidies only applies to my spouse and tax dependents. My 25-year-old investment bank, my 25-year-old, this is actually true too, Kevin, you know this is true. My 25-year-old rock star son, who has a band and has an annual gross income of $11.33, that was in tips, because he's not my tax dependent anymore, okay, could qualify for subsidized coverage on the exchange, even though I have to cover him on my plan. As long as he doesn't take the coverage. If he takes the coverage on my plan, he loses it, but he would be eligible. But our families and our dependents, our tax dependents, are disqualified from the subsidies based across single coverage. All right, real quick, 101, how does the subsidy process work? Everybody asks us, well, how are they going to get that money? How are they going to get that tax money? Well, if I qualify for the tax credit, I have a choice. I can either take that on the fly, it's called an advanceable tax credit, or I can decide to just pay my insurance premiums and file for my tax credit at the end of the year. Most people obviously are going to do what? They're going to take it on the fly. They don't ever see the money. If I qualify for a tax credit, the exchange tells me what I owe for my insurance. And then the exchange picks up the phone and calls the IRS and says, send us Bob's tax credit to give to the insurance company. Well, I don't know if that's exactly how it works, but you get the point, right? So I never get my grubby little fingers on the money, right? The money goes directly from the federal government to the insurer for the portion of my subsidy that I have. Now here's the thing, people's lives change. I qualify for the subsidy January 1st because I'm low income, I get a job July 1st. My income is decent, now I no longer qualify for the subsidy. What should happen? Well, I'm supposed to notify the exchange that my income has changed and I'm no longer qualified for the subsidy. Ha! Yeah, that's going to work well. So when I don't notify the exchange, here's the catch. When I file my tax returns next year, I'm going to get a notice of the subsidy tax dollars I've received. And I'm going to have to certify on my tax return that I was eligible for that subsidy the entire year. And if I wasn't, I got to get some of the money back. That's how it works. And again, I get this question almost every time, so I'm just going to take it right out of your mouth. Aren't people going to cheat? That's how I always get asked. And I go, it's taxes. When I put gave my sweater to the Salvation Army, I said it was a Ralph Lauren sweater worth $550. I did not. I mean, if you're going to lie on your taxes and say you're eligible the whole year, you got a chance of getting caught and getting whacked. I mean, that's how the system works. Okay, so that's how this tax credit is going to work. All right, let's end with this, and then we're going to turn it over to Brandon. I got one example to give you. Oh, before I give you the example, I said earlier, very few employers are going to pay the penalty because coverage is unaffordable, right? The same applies to very few employees. Listen, very few employees or their eligible family members who are eligible for employer-sponsored insurance will ever get this tax subsidy. Do the same math. Take somebody with a $24,000 household income. How many of them have to pay more than $190 to participate in single coverage on their employer's plan? Not very many. This is what was missing from that exchange notice you all sent out. Remember that wonderful notice that told employees everything they needed to know and made everything perfectly clear to them that you sent in September? God, I hated that notice with a passion. Because it didn't say this. What you needed to say was, hey, most of you employees, ignore this. Right? Because the vast majority of employees that are eligible for affordable coverage, none of this matters to them. Okay? So here's my example. I'll show you how it works. And some of you have seen this before, but let me just show you one more time. I'm just going to go with one line. This is how the tax credit works. Let's look at the first line. Take a 30-year-old family of 4. I just went out on a website in Minnesota to an insurance company and saw what I could buy a $2,500 deductible plan for a 30-year-old family of 4. So that $860 there, that's just a placeholder. That doesn't mean that's what insurance costs in Washington. That doesn't mean it's what insurance is going to cost that same family next year. It's just a placeholder so I can show you how the math works, okay? So I'm buying a policy from an insurance company for my family of 4 that costs $861 a month. I'm going to say this family of 4 has an income of $70,000 because that puts them at 300% of federal poverty level. The formula works off my federal poverty level. plug 300% of federal poverty level into the formula in the law, and it says this family will pay no more than $554 a month for silver coverage, which is about a $2,500 deductible plan or so. That's why I'm using that, okay? So what the formula does is it sets the maximum premium I will pay. But the insurance company wants $861. Where's the $308 going to come from? The tax credit. That's it. That's the tax credit. Okay? Now, if I want to go buy, once my tax credit is set at $308 in this example, if I want to go buy a more expensive plan, if I want to go buy a platinum plan or one of those really fancy-dancy plans that's a lot more expensive than the silver one, I have to pay the full difference. I don't get any more subsidy dollars. I have to pay the full retail difference for whatever plan I decide to buy. Okay? Now, here's where it's all going to make sense. The light bulb's going to go off here. Now, let's take the same exact family, same exact insurance policy, from the same exact insurance company, and cut their income in half. Remember what I said? I plugged 150% of federal poverty level into the formula, and this family will pay no more than $117 a month for that same policy, because it's based on their federal poverty level. Okay? And now the subsidy that's coming from the government is $745 a month. Remember when I said the subsidy is going to be much larger the lower your income. Now, the other thing that I just didn't say, I forgot to mention, by the way, there's a typo in the slides that, actually, we didn't hand them out. We'll fix this. You're going to be able to download these slides, okay? And remind me, the one that I gave you originally had a typo. It said 300% on the slides, so we've got to fix that before we post it on your website. But the other thing I didn't mention is look at the max out of pocket. For lower income, the subsidy is not just a tax credit. They also get their out-of-pocket deductibles and copays reduced. So this family at this low, the family at 300% has the max out-of-pocket of the family the full amount, $12,000 family out-of-pocket maximum. That family at 150% of federal poverty level, their maximum they'll pay out of pocket is only $2,000. So not only do they pay less for the plan, it's a lot better plan. The carrot and the stick. Okay? So I forgot we added this. The last comment is we're going to tell you there's some other things happen. Oh, by the way, you now know more than 99% of the country on how the federal subsidies work. Okay, that's why you should not tell your relatives about this. So there's a few things outstanding that we're waiting on. I just want to tell you we're still waiting on it. We'll give you guidance when we can find it. You've heard about that there's going to be non-discrimination rules that are going to apply to fully insured plans someday. The IRS has not issued guidance on that, and they've said these non-discrimination rules for fully insured plans will not go into effect until the first plan year sometime after guidance is issued. That's important, because if they came out today, it may be next July before they're effective. They'd have to tell us that when they release it. The other thing that large employers have been worried about is this automatic enrollment processes in the law. Employers with more than 200 are going to have to automatically enroll new hires in a health plan. The Department of Labor has also delayed implementation of this until they issue guidance. We don't have that yet. We don't know when it's going to be. And then one last comment on the Cadillac tax. We're starting to get questions about that again. That's the tax you're going to pay on high-cost health plans beginning in 2018. Two things about the Cadillac tax. I will be retired before then, so I won't be helping you with that. And we have no guidance on it yet. So there's a bunch of stuff. You've heard about this Cadillac tax, but we really can't tell you your actual number, because you might have heard that there's a number in the law that if your cost of your plan is above a certain amount, you're going to pay this tax. Well, that number is going to be adjusted for demographics in a group. So it's not really your number. Okay? And we won't know how to actually figure your exact number until we get guidance from the IRS. Well, this is 2018. I would be shocked if we see guidance on this before the end of 2015 or 16. Right? They got a lot on their plate right now, so I do not expect detailed guidance on the Cadillac tax for at least another couple of years. That was a lot of ACA update stuff in an hour. So what we're going to do is we're going to shift gears here now. I'll bring Kevin back up. We're going to shift over. Brandon is going to talk about some new things that we're working on in terms of different kinds of exchanges. But Kevin, why don't you take it?
Thanks, Bob. And hopefully he was able to cut through some of the noise and confusion that most of us face around this subject. Anybody have any general questions that they want to ask?
Yeah, so, sorry about that. Question was, are tax exempt and not-for-profits treated the same? For all practical purposes under the Affordable Care, yes. I mean, there's a couple tiny little differences, qualification for a small business tax credit, and a couple things that are slightly different, but if your responsibility to cover people, whether it's affordable or not, penalties that apply, all apply exactly the same to a not-for-profit as it does to another organization. That's correct. Shannon?
Hey. Bob, would you go back to the individual mandate and sort of that transition rule for non-calendar year plans?
Oh, go back, I didn't forget to talk. So, thank you for reminding me. One thing Shannon said, make sure you cover, and I forgot to cover it. I'm under blacklist now. The individual mandate, your employees will pay a tax if they're uninsured starting next year, right? We talked about that. There is a conversation going on whether you want to let your employees come into your plans mid-plan year if you're not a January 1st, right? If you're July 1st and somebody didn't take benefits last July, the IRS has allowed you to amend your cafeteria plan to let them make an enrollment mid-plan year. So you're allowed but not required to do that. Well, subsequently, the IRS came out with a transition rule that kind of made that less important. Employees will not owe the tax if they work for a company that has a non-calendar year plan for the months up to the renewal. So if you're a July 1st plan year and somebody did not enroll last year, it's not a worry anymore. They can enroll next July, and when they do their taxes, they will not owe the individual mandate tax for January, February, March, April, May, and June. It's actually calculated on a monthly basis, 1/12 of $95, right, if that's the case. So what that did when they did that transition rule, it made it less important for us to put this alternative in place to let people in mid-year, right? Because they're not going to get taxed now. And I don't know about you, how you feel about it, but I think that would be a bit of a circus. It's an entirely new middle of the year enrollment period, since they're not going to get taxed anyway. Kevin, I don't know if you want to comment. I'm seeing very few employers implementing a mid-year enrollment option now because of that transition rule.
Not so far.
Thanks for reminding me. Other question?
Before you're referring to the non-discrimination rules that have to do with the tiered benefits offered. For example, if you have a lower level employee who pays $75 towards a premium, and you have maybe your CEO who has herself and her entire family paid for out of the operating fund, those different benefit levels, that's that discrimination rule takes effect 2016.
I wish I had a crystal ball. So the question is this. So let me give you the 1 minute overview of the non-discrimination world in health insurance. There is already non-discrimination rules that apply to all you self-funded employers. And you self-funded employers have been struggling with the 105H non-discrimination rules for many years. We can't offer benefits in a way that discriminates in favor of our highly compensated individuals, right? That doesn't mean it has to be identical to everybody. There's tests. This is a self-funded world, been around for years, okay? What the ACA did is it instructed the IRS to issue guidance for fully insured plans similar to the 105H rules. In my business, I hate the word similar, okay? Because what does that mean? Well, the IRS then a couple years ago said they're going to delay enforcement, non-discrimination rules, until after they issue guidance. If you had asked me this question a year ago, I would have said I would expect it in January 1st, 2014, when the employer mandate came out. When they delayed the employer mandate, my bet now is the soonest we'll see it would be effective for January 1st, 2015. Don't hold me to that. They could still surprise me. But I expect to see the non-discrimination rules come out sometime next year for fully insured plans with effective dates of plan years starting January 1st, 2015. That's just my bet, okay? Now, to your other part of your question, if I pay more for insurance coverage for my CFO and my CEO and less for everybody else, that's pretty clearly going to be considered discriminatory, and that's going to need to be fixed, okay? And let's leave them with some good news. If that's the only reason you're discriminating, there's a relatively elegant and easy fix. I'm going to leave you with, a lot of people don't talk about this. I pay 100% of the premium for my CFO and my CEO. I pay 50% for everybody else, right? How do I fix that? Well, I pay 50% for everybody. And then my CFO and my CEO are mad. So I increase their pay by the amount I used to have been spending on their insurance. And we have a cafeteria plan that allows them to do what? Make employer contributions to their health plan on a pre-tax basis. When I increase their pay and they turn around and make that 50% contribution on a pre-tax basis, they are exactly into the same position they were to the penny the day before. Do the math. I've been through this conversation with about a dozen CFOs. You'd think CFOs would get this. They still think you're taking something away from them, okay? So you got to walk them through the numbers. But so if the only discrimination is the contribution, it's easy to fix. There's other forms of discrimination. I let them enroll day of hire and everybody else has a 9-day waiting period. Or I give them better bet. There's other ways I can discriminate, but if that's the only way, it's pretty easy to fix.
Okay. Any last questions? Well, I want to thank everybody for joining us today. Obviously, we still have a lot to talk about going into 2014. I know that we do have more webinars coming up. The next one is Wednesday. Shannon, maybe you know, is it Wednesday?
November 20th and 21st.
The 20th and 21st. So there are flyers on that on the registration table in the front. Please, again, contact us if you have other questions regarding this. We look forward to continuing the conversation.